Okay, and I will go ahead and turn it over to Kaylee Herby. Kaylee is the Epidemiology Program Manager for the Health Department, and she is leading a lot of the activities we have going on with COVID-19.
Good afternoon, everyone, and thank you for joining us. And we're pretty excited to have an interesting agenda for you, as well as an expert from the CDC to give you some information. So it's a little bit of an update. Hang on one second.
What should we do?
All right, so we're going to do a COVID-19 update, then discuss some of the new services available to you, do a little bit about our disease notification protocols, and then again have the CDC provide more information. So as of noon today, there are just over 1 million cases of COVID-19 in the United States. We have 3,491 in Kansas, 354 of those in Sedgwick County. We have had 174 people recover. We've had 6 deaths, and we currently have 8 clusters. So some new services that we are offering, hang on, we have somebody who's not hearing any audio. Can other people hear me? If you can, okay.
Yeah, I want to hang up. Okay, sorry about that. Can everyone hear us now?
Great. So I'm going to go back a couple slides. Well, I'm trying to. Okay. So, we have, again, just to go over our agenda, we're going to talk about an update to COVID-19, and then new services that are available to U.S. long-term care, our disease investigation protocol, and then we will have the CDC provide their updates, and then you'll have a chance to ask questions that you have. So, as of noon today, we have just over 1 million cases in the United States. We have 3,491 in Kansas, 354 in Sedgwick County, 174 people have recovered, and we do have 6 deaths and 8 clusters. So, new services that we are going to be able to provide to long-term care. So, any long-term care facility staff can now be tested at the health department for no charge regardless of symptoms. So that means if you are asymptomatic and just need to be tested or want to be tested, you can get tested through the health department now. And if a staff or a resident at your facility does test positive, we're recommending that everyone at your facility be tested, both residents and staff. And this testing can be done by the health department, or it can be done by your facility. We'll work with you to figure out how to do that testing. You can also request personal protective equipment from the Emergency Operations Center if you are needing that to protect your staff. And a new thing that has just come out and they're still working out the key, the state now has a machine that allows N95 respirators to be decontaminated. And so keep an eye out for more information on that. I would recommend that you, if you're not part of the South Central Healthcare Coalition, that you go ahead and join that. And Deanne Conkle is our coordinator, and we'll be putting out updates on that information and on that machine. So if you want to get tested, or if your staff would like to get tested, all you have to do is 211 and tell the operator that you work in a long-term care facility, and that will get you transferred to a Sedgwick County Health Department nurse who will schedule your testing. That testing will be done at our 2716 West Central, and that is via a drive-through, and so you don't have to get out of your car. You can just pull up and get through the testing, and it really doesn't take all that long. And then after you're tested, you should receive your results within about a week. So for your facility and for preparedness, if you or your staff do have symptoms, then don't go to work until you have your test results back. And that makes sure that you're not symptomatic and then spreading it in your facility. And we also recommend just if you have symptomatic employees, not to have them come to work at all, regardless of if they're being tested or not. If you're someone who does not have symptoms, but it did choose to get tested, then we recommend that you continue practicing the standard social distancing, stay 6 feet away, wear PPEs per your facility protocols when you are working, just to make sure, again, that you're keeping everyone safe. So if you are positive from your testing, then you must stay at home, isolated from others in your house until 72 hours after symptoms stop, or 7 days after symptoms start, whichever is longer. However, if you're an asymptomatic person who tests positive, so you're positive and have no symptoms, we're having you to stay home for 7 days after test date before you can return to work and resume your normal activities. So what we do when we get a positive case, the health department staff contacts that case and identify all of their close contacts, and then we will do interviews with those contacts and provide them with quarantine instructions. And we are also now recommending that all close contacts of a positive case be tested, so they can follow that same process. Call 211 and just say they're a close contact of the case, and we will test them regardless of symptoms in the health department. So if you are exposed to a confirmed COVID-19 case, and one of your frontline workers is in quarantine, then the recommendation right now is that person should be tested about 7 days after exposure. That 7 days allows time for the viral load to develop in the body, and so you're less likely to get a false negative. And also, if you're in quarantine, if you test negative while you're in quarantine, then you will need to remain in quarantine for 14 days from exposure to the last case. However, there is an exemption allowed for healthcare workers through the state of Kansas, and so you may be allowed to work after exposure to a case as long as you wear a respirator at all times and follow your organization's guidelines and still participate in active monitoring with the health department. So if that situation does arise, we will work with you and your facility to ensure that your workers are able to work if possible. So now I'm going to turn it over to the CDC and allow her to provide her update.
If you would give us just 1 second to make sure we get you unmuted, please.
Hey, hi everyone. Afternoon. Can you hear me?
Yes, we can.
Okay, perfect. All right. I wasn't unmute myself. Thank you to Sedgwick County for giving me this opportunity to talk to long-term care facilities in the county. I wanted to start off by first thanking everybody who is on the front lines, especially in long-term care where, there aren't necessarily the attention or the resources that hospitals get, and the work you all are doing is truly valued at CDC. I think we're doing some of the toughest work that's out there, and, what we're hoping that our guidance and the information we put out is that it helps you all take care of your patients safely as well as stay safe, both, facility administration and staff. We've learned in the last month and a half, it feels like it's been forever, but really it's just been a month and a half since we started to really have a surge in cases in the U.S. But one thing that is unmistakable is that long-term care is one of the main places we need to focus our efforts to prevent more from this organism. And there's been such a focus on this setting particularly, and I appreciate everything that Sedgwick County is doing to focus. Have a special webinar for this, as well as the testing resources and the disease investigation resources that are being put into this, because I think to get ahead of it this is one of the main settings. And I'm sorry about all this noise. A lot of what of the guidance and regulations that have come down, it seems like a lot. It seems like how can we keep this up for a long time? But unfortunately, based on what we know about how transmissible this virus is, it really is very, very essential. And what we're also learning is that the things that we've already asked nursing homes and other long-term care facilities to put into place, like visitor restriction, monitoring residents and staff for temperature checks and symptom checks and universal masking, these things are all necessary, and we would be in a much worse situation if we didn't have that, but these things are probably not going to be sufficient in order to prevent transmission and even introductions into nursing homes. And so we're really emphasizing that every facility should make sure that they're doing those, what is considered to be minimum requirements to control COVID. And again, that's the visitor restrictions, stopping communal dining and communal activities and keeping residents as far apart as you can, monitoring them for symptoms, monitoring staff for symptoms, and universal masking. Those are like at least the minimum that must be done. And I know that it's definitely causing some distress among both staff and residents to keep them sort of, locked up in their rooms and not being able to come out. It definitely affects mental health, but this is an unprecedented time where even in a state, Kansas, which doesn't have a lot of cases, we're seeing a large number of long-term care facilities that have at least one case. And so that makes it really compelling that these facilities, these types of settings really do need to take precautions. And so I said those are necessary but not sufficient. And I think the next sort of layer of what we've learned is that in addition to that, we probably do need to be focusing a lot more on testing more extensively in nursing homes. And I see that Sedgwick County is supporting a lot of that. We want to be able to respond to a case very quickly by testing those around them, because what we're learning is that people don't have just cough, fever, and shortness of breath. They have all kinds of symptoms, and many people don't even have any symptoms. And so in order to know who's positive and who needs to be separated from those who are negative, we really do need to be doing a lot more testing of both staff and residents, because I think that's the way we might eventually be able to control this. So highly encourage you to report any suspect cases, both among residents or staff in your facility, to the local health department so that those types of actions can be initiated as soon as possible. We know from experience in Seattle that once a nursing home has several cases and it keeps going without more intervention, that a large majority of patients, like more than 50%, in some cases 80% of residents got infected, and almost a third of staff got infected. And so we don't want too many places to get to that level, and that's why all of these basic control measures are needed, as well as probably the enhanced testing that the county is providing. And on top of that, we always emphasize proper hand hygiene. That's important for any infectious disease, and also proper wear of PPE. So in-services for staff are really valuable, and ongoing, correction on the spot if you see someone wearing something wrong, or donning and doffing being done incorrectly. So these are all going to be very important for the control of this outbreak. And despite all this, we might still continue to see cases, but I think we have to do this minimum in order to try our best to protect residents and staff. So I'll stop there and see if we can start taking questions, or Sedgwick County has other things to add.
No, we don't have anything to add, but thank you so much for providing your information. And we did get one question through while you were speaking, asking how many long-term care homes in Sedgwick County have had a COVID case. I'm not aware off the top of my head the number of facilities that have had one, but I will say we've had 2 clusters in nursing homes. So 2 of our 8 were in long-term care facilities.
And I didn't introduce myself earlier very properly, but I, Dr. Sigda Volcan, infectious disease physician. I work at CDC. I normally work on antibiotic resistant nursing homes, but have been doing quite a bit of work in long-term care with COVID in multiple states since the beginning of this outbreak. Okay. So I see a question that says, could Snigdha tell us a summary of her experiences in other states? And so, you know, the experience of long-term care has been very different in different places. And you've probably seen a lot of this in the press. But, for example, I was in New York City a few weeks ago, right when they were peaking with their really the worst type of infections, where they were having about 10,000 infections a day that they were diagnosing, and there's probably a lot more than that. And I think we are all benefiting actually from the experience in New York, which was unfortunately not great, but we learned from that experience that we really need to be proactive in what we do. In New York, they went from they have about 600 nursing homes in the state, and many more assisted livings and all of that. And we learned that within 2 to 3 weeks, they went from having their first case in a nursing home to having, more than half of their facilities, most of that concentrated in the New York City area, having cases of COVID. And it wasn't just one unit or one patient. There were many facilities that quickly had, half of their patients be suspect cases, and many staff out sick with crisis level staffing needs. I mean, many people can say, okay, that's New York City, it's not us, it's not in Kansas, but this story has repeated over and over in many areas: Louisiana, Chicago, Michigan. These are all places that are having similar issues, where you'll start off with what looks like one small outbreak in one nursing home, and pretty quickly, because of the level of community transmission they're seeing there, pretty quickly many nursing homes will be involved. And it's not cases. Once it gets into a nursing home, it really gets, it really spreads very quickly. And this is among people you don't even know have it, because it can be asymptomatic. And so really the proactive measures that outlined by CMS and CDC are critical to minimize the chance of introduction into the facility, because once it gets into the facility, it's incredibly hard and resource intensive to manage. And that's why, part of my message also has been, you actually don't know who has it and who doesn't. And that's why in our communities, the social distancing is so important and valuable. And then in the healthcare facility, it's the universal masking, it's the hand hygiene, it's trying to keep people as separate as you can, including for their employees, so not taking breaks together where you're unmasked. And that kind of thing, I think, will really help, because we've learned from the experience of other states that it can get very bad and very quick.
Thank you. We received a question about how is the PPE request from the University Operations Center being filled? And are there requests that are being denied? I don't know everything about the Emergency Operations Center, so I'm not sure if they are being denied or not. But you can go to Sedgwick County's website, which is sedgwickcounty.org, and on there should be a section for emergency management, and they would have a form on that page for submitting your resource request.
And we will put together all of these resources and email them out after this webinar, so you won't have to remember all of this. We will write this down into a document and make sure everyone has a copy of that.
The next question we got is for Snigdha. It's, what is the CDC or recommendations for a phasing in plan of allowing residents to begin having visitors or socializing in small group settings? Will residents not be allowed to have visitors all summer?
So I think just like the return to work and sort of opening up type of plans that are, being put into place right now, we anticipate we will have some guidance around, when this can happen, and it most likely will depend on what is happening with community prevalence, because that is a big driver of how much will be introduced into the nursing home setting. And obviously, nursing homes are going to be the most vulnerable. Nursing homes and assisted living will be the most vulnerable places. So I don't think we're ready to say anything about visitors yet. I anticipate that guidance will come down the line once we see what happens a little bit with, as we start to open things up and what happens with community transmission. So I think if you're in places where you have a very good sense of community transmission, there's a lot of testing going on, a lot of contact tracing, and we can keep it controlled in the community, I think those will be the types of places that will have, be able to potentially restart having visitors, sooner than other places where there's still uncontrolled transmission.
Thank you. The next question is for us at Sedgwick County. It's asking, can we test a resident without having them leave the facility? If you are capable of testing the resident yourself, you can do so through a private lab. If you don't have that capability, you just need to reach out to the health department, and you can do that through the 211 line, or you call our main number at 660-7300, and someone from the health department, we do have a branch set up that can go out and assist you with testing of your residents in your facility. And then we've also put the resource ordering form and the link to that into the chat box if anybody needs that.
Okay, are there any other questions or comments? You can unmute yourself and ask that question, or you can type your question into the chat box and we're happy to answer. Okay, well, if there's no more questions or comments, like I said, we will be sending out a document shortly, and then we're also going to have our organization reach out to you and give you a call to see if you have any additional questions or comments or concerns, and we will follow up to you on an individual basis. Expect those phone calls start tomorrow and to go through the end of this week. We hope to have everyone contacted by then to see if you have any questions or further feedback for us. We will go ahead and keep the chat box open, but actively mute for the next few minutes to see if anyone else has any questions. And it looks like, let's see, one question is, so can residents be tested if they are symptomatic?
Yeah, if residents are symptomatic, then they can be tested through the health department. We will assist you with that. And if they are asymptomatic, then we can, if you've got a case in your facility, we would recommend testing them regardless of symptoms.
And as assistant of the CDC, I just want to emphasize that we do think this is where the White House and people who are thinking about how to control these outbreaks are trying to go is looking like as soon as we have our first case, can we test more extensively than just testing symptomatic residents and staff to try to detect these outbreaks, the size of the outbreaks sooner rather than later, and put control measures in place. So very exciting that the county's offering this.
And then we got another question asking, is there a time restriction for reporting a positive? So COVID-19 is technically a 4-hour reportable disease, which means you should report it to either the local health department or the state health department within 4 hours of the positive. Typically what will happen is we get the report from the long-term care facility and also from the state around a similar time. And then what we will do is reach out to your facility and provide you with some guidance from KDHE on things you can do coordinate with you to determine if there's testing is needed or assistance with testing is needed, and also have you start completing a line list for your facility, which is going to be information about people who are sick, people who tested positive, just so we can start to keep track of everyone in your facility, where they are, when they were, their symptoms onset, kind of to help us and you have a clear picture of what's happening. So there's a question asking, can we tell us where clusters are at in other facilities so that we can better prepare if staff are shared with that facility? One of them has been reported out already through the media, so that one we can share. The Clearwater, and I can't remember the whole Clearwater rehab, I believe. The other one has chosen at this time not to release, so I can't tell you anything about that.
I'm going to say one potential strategy, this is saying that one potential strategy is like if you do have staff that work in multiple facilities, I think all staff should be encouraged to get tested, but if, especially those staff, if they're working in other facilities is one idea, because you may not know everywhere that has an outbreak.
And then, so another thing that we can do with you when you have a positive at your facility, and particularly when you have a cluster, we offer to work with you to put out a joint press release. So that is something that comes from the county and your facility, and just describe the situation. And our goal with that is really to help you kind of get the word out, but also manage the media. And so with that, we will take on the media calls and try to help you, coordinate that side of it so you can focus on your facility and your residents and making sure everyone is safe in your facility.
Okay, so we will wait another minute or two to see if there's any other last questions, and if not, we will plan to end the meeting by about 3:38 or so. So just a few more minutes. We're going to go ahead and mute, but we will be waiting to see if anyone else has a question that you can go ahead and unmute yourself and ask, or you can type it into the chat box.
Just to control the meetings and the call. So the whole thing is, and they all share the same account. And if you log in on this one time, it will always automatically log in and it's all permanent again. So we have shared one. We shared two seconds. Huh? There's two WebEx accounts with email.
Yes.
Yes. This one went much better before. It was much less silent.
So, I created that. So we're going to give this about one more minute, and then we're going to go ahead and exit after that. Thank you for participating, and we wanted to say too, we will be calling each one of your facilities in the next 2 to 3 days, and we will send out some more guidance and information with some of the resources we talked about today. Yeah, you're good. Who else? Yeah, she's in her office, yeah.